we've worked many months, particularly Dr. Epstein has worked many months to deal with fracking, and so why don't we take it out of order and just do that? Let her have it, and I think we have plenty of time, but I'd like to give her the floor and get her started. And just one other note would be, I appreciate the City Council acting on getting the 5 of us back on reappointments. I think that the great thing is that even though we got to bring Ollie up to speed a little bit here, and he's a quick learner though, that all the rest of us are just kind of old members now, and so we kind of know what we're doing, and so I think we can in the next couple of years get some really good stuff done. So I appreciate everybody being reappointed, and those who will come back up that we will stand with you too and get through that. So with that said, I will turn it over to Dr. Epstein for her report on hydraulic fracturing.
Thank you, Brian, and I would like to express my appreciation to the other members of the Hydraulic Fracking Committee, Brian, Ted Reed, and to other members of West Texas Accountability Project who have assisted us in trying to get hold of this complicated and technical subject. So let's begin here. The question for us here on public health is, how can best management practices be used to reduce the public health risks that are inherent in fracking? So what we're talking about here is the concept of responsible drilling. So from a public health point of view, a picture of a drill rig and the entire drill pad. You can see some of the trucks and the size. And notice the size of this thing. This drill pad is probably 3 or 4 acres in size. Just to summarize the risks that we're trying to manage, the main public health risks are water depletion, especially predominant in this drought-stricken area, surface and groundwater contamination, toxic air pollutants. In addition, there are a number of other risks which we classify, group this large number of things under nuisances, noise, dust, traffic, surface disturbances, danger to livestock, wear and tear on roads. Let's talk first about water usage. I'm sure you'll recognize this picture that was run in the Texas Tribune about water usage issues in drought conditions. And we previously reviewed the large amount of water that's used in hydraulic fracking operations. And just briefly, these are the amount of numbers of gallons of water that it typically takes to frack a well in different shales, ranging from, in most of the major shales, between 3 and 6 million gallons of water. Some shales take 8 million gallons of water per well. Some have gone as high as 13. On an individual basis, this does not represent a great deal of water. However, in areas of very large and intense oil and gas development, this can become very large. In the Barnett Shale, the use in Dallas approached 9% of the total room usage in Dallas was being used for fracking. This has become increasingly a problem that the Texas legislature is concerned about. As a matter of fact, today I received in my oil and gas newsletter mailbox an article called "Legislation Targets Mandates for Water Recycling in the Oil and Gas Industry." Once again, the Texas legislature has become concerned about oil use in drought. Let's talk about how to handle the problem of saving our water. The Texas legislature is talking about recycling water use. Is about recycling. There is a technology in existence, closed-loop drilling, that involves recycling water on site and storing it for reuse, where it's reused in the next well. And closed-loop drilling with its recycling program has been shown in some cases to reduce water use by up to 80%. Another possibility that we discussed at the last meeting with Audrey Spears, who presented to us, was the use of non-freshwater sources for fracking. This is a picture of a closed-loop drilling system, and we're not talking about a box here. We're talking about an extensive system involving storage tanks, shakers, and centrifuges. And this, I believe the Avalanche Journal ran this picture as well. So a closed-loop system is a technically complex group of machines. However, a number of companies are selling closed-loop systems as what the Railroad Commission has called a turnkey system. An industry can buy a closed-loop system as well as some of the expertise that goes with it and utilize it in their operations. What does a closed-loop system do? It continuously cleans and recycles water on site as produced water comes back from the well. And it routes that flowback water directly to storage tanks and eliminates pits, storage pits, and we'll talk more about pits in a moment. Let's talk about the next problem in public health risk in fracking, groundwater contamination. In New Mexico, the largest source of contamination, groundwater contamination, was found to be open pits. And you can see in this picture, this is the entire well pad here, and these are the pits. These are open pits containing large amounts of water. Most of this water is produced water, that is, water containing flowback from the wells that's contaminated with stuff from the ground as well as stuff that went in, the fracking fluid. And there it is, open to the air. So there have been many problems with pits, including stormwater drainage. You can imagine a West Texas thunderstorm pounding into this, and it would be hard to imagine it being contained. There are a lot of spills from the pit itself, going in, coming out, getting it in and out of trucks. They were found to be the #1 source of groundwater contamination. How do we reduce the risk of groundwater and surface water contamination associated with pits? Closed-loop drilling. Closed-loop drilling, as you recall my saying earlier, completely eliminates pits and would be the favored method of reducing the risk of pits. In addition, the flowback fluid goes directly into storage tanks from closed-loop drilling, so there's not the exposure to the air that the flowback fluid has while transferring it into pits. There are other methods of reducing pit risks besides closed-loop drilling. The next best would be using closed containment tanks instead of the pits. Then you don't get the benefits of the closed loop, the closed containment. And barring all that, you can line the pits with plastic. Let's look at other sources of groundwater contamination that have been found to be associated with hydraulic fracturing operations. Now, when I'm talking about fracking and the risk associated with fracking, I would like to be clear about what I'm referring to. I'm not referring to the technical aspect of flowing water down at high pressure and breaking rocks. That's fracking in the narrow sense. I'm talking about the entire process of natural gas well drilling, exploration, and the associated phenomena that comes with the drilling. So what I've mentioned so far is not particular to the cracking the rock process, but to the entire process surrounding drilling. These are other sources of groundwater contamination, and they're very large. These are spills and accidental releases of toxic fluids per well. This water contains toxins. It's small by percent, but large by volume, and it can affect groundwater. And wells have problems. Tank ruptures, blowouts, equipment failures, accidents, fires, operator errors. This is life in the drilling rig. Here's a picture of a hydraulically fractured well blowing out. And we've all heard plenty in the news about blowouts. Here is a fracking fluid leak due to a blowout. That's fracking fluid with all its toxins, potential toxins spraying into the air. This was just in, this year occurred in Colorado. How much of a problem are spills and leaks? I went to the Texas Railroad Commission website where spills are required to be reported. And for the last complete month that I saw in 2012 in Texas, there were 65 spills reported. Considering the number of wells that are drilled in Texas, this is not a very large percent. But each spill can become a significant public health hazard, and these are hard to clean up. In New Mexico, there were reports. The time course I'm not sure about. This may be since drilling began. 743 incidences of groundwater contamination. Pits were the #1 cause. There are other sources of groundwater contamination as well. Toxins in fracking fluid. The stuff that comes back from the earth after drilling, it contains naturally occurring chemicals and some radioactive material. And there is some risk of underground migration of toxic fluids due to improper casing and cementing. This refers to the technique of well exploration. Right after the well is drilled, the well bore should be cased with steel and cemented. And that's a highly technical process with a failure rate. Okay, so to summarize these things, let's look at reducing the risk of groundwater contamination. How can we reduce the risk from spills and leaks? Closed loop drilling. And we can monitor for groundwater contamination so that if there are slow leaks that we don't know about, we can discover them and potentially ameliorate them before they become large and reduce the public health risk. There's toxic fracking fluids. We can try to reduce the chemicals in toxic fracking fluids. Now, industry is leading the way here, and several companies are trying very hard to attempt to reduce the amount of toxic additives in fracking fluid. Diesel needs to be used in fracking fluid. Diesel is a big component of contamination risk. It's currently illegal. And I'm very pleased to see industry trying to develop low toxic fracking fluids. The other thing we can do is we can disclose the composition of fracking fluid to the public before drilling begins. Currently, Texas legislature passed a law requiring disclosure of fracking fluid content so we know what to monitor for. Unfortunately, disclosure, to my knowledge, is required after drilling starts. If we know what's in the fluid before the drilling starts, we can know what to monitor for, and we can have a good baseline. Failure of well integrity. This is blowouts, leaks, spills, accidents, errors. We can have well inspectors and safety equipment and procedures. Now, let me say a word about this. Currently, well integrity issues are regulated by the Texas Railroad Commission. And they have very good, as far as I know, very good casing and cementing requirements. The problem with the Texas Railroad Commission is a lack of inspectors and a lack of money required to evaluate all the wells. At the present present time, each inspector would be assigned over 1,000 wells to inspect per year, which is more than, I believe, any other state. And it can't be done. So the problem is not so much standards of well integrity. The problem is enforcing them because of lack of personnel and lack of funding for the Texas Railroad Commission. You may know that the Texas Railroad Commission was recently reviewed by the Texas Sunset Commission. And so one of the things we can do to address this problem of inadequate inspection and enforcement issues is to have our own well inspectors and to have additional safety equipment and procedures. And then there's an issue of proximity to sources. The further you are away, the less likely contamination is to affect you. And that has to, and the treatment, the amelioration for that is to set wells back. And we'll talk about that shortly. This is a picture of the CEO of Halliburton Company drinking fracking fluid. His company, Halliburton, has developed a fracking fluid called green stem that is supposedly made only of edible substances and is drinkable. He took a sip in public to endorse his product. And this is a very exciting development in technology. He believes in what he does. Let's look at air pollution issues. This is a drilling rig in the Dallas-Fort Worth area. Those of you who recognize the skyline might tell me exactly what it is. You notice it's pretty close to high public use areas. So the question is, these rigs emit a lot of air pollution. Do we in Lubbock need to worry about this? There was a very interesting study that suggests that yes, we do need to worry about this. Basically, the researchers looked at oil and air quality 500 feet from a well and again half a mile away from a well. And they calculated what's called a hazard index for the toxins that they found in the air. What they found was that people who lived less than half a mile away from a well were at greater risk of health impact from air pollution. And that most of these air pollution risks occurred during well completion activities. That's all the fracking, the drilling, the active well drilling activities. There was what's called a subchronic non-cancer hazard index of 5 for people who lived less than half a mile away. What that means is that a hazard index of more than 1 is considered unsafe and potentially at risk of causing human illness. These people have a hazard index risk of 5 subchronic exposure. In other words, 5 times what's considered the safe level. Subchronic exposure refers to repeated exposures over a long period of time from well completion activities. The kind of thing that you would have if you lived there, if you were a child and you went to school there, if you went to repeated meetings at a place or you worked in an area around that place. This is subchronic exposure over a long period of time gives you an increased incidence of health problems related to air pollution. There were also risks. The health risks were divided into 2 types, cancer and non-cancer. It's the non-cancer risks that were 5 times as great. The cancer risks were a little under 2 times as great. That's this bottom line, 10 in a million for people who lived within half a mile, 6 in a million if you lived over half a mile away. Let's look at air emissions from oil and gas wells, which was one of the largest sources of public health risk. How do we mitigate these risks? The Environmental Protection Agency has passed standards that will become effective. These things will become law in January 2015 that require companies to capture natural gas released from the wells instead of venting it. And this requirement reduces the risk of those air emissions that can cause the serious health problems that I spoke about. This requirement saves industry money. It saves it because we're talking about capturing emissions. Those captured emissions are saleable product. This is methane. And so the EPA projected $11 to $19 million in savings when these emission standards become active January 1st, 2015, about a year and a half from now. Diesel trucks, another big source. There have been estimates that there are about 1,200 diesel truck trips per well. There's a lot of trucks, and most of them run on diesel. How can we reduce truck traffic and pollution? Once again, closed-loop drilling reduces water usage by recycling. And because it reduces water waste, it reduces the number of truck trips required to carry the water. It also reduces the waste volume that needs to be transported to the wells. So you have less water, you have fewer truck trips, you have less waste, you have fewer truck trips. This is tremendously decrease in trucking. You can drill multiple wells from the same pad, and that once again decreases the need to use a truck to transport recycled fluid to the next well. It's already there, it's already on the pad. And some people have recommended using natural gas instead of diesel for truck engines. This is being pioneered by Apache Corporation, which I believe has spoken. CEO has spoken in Lubbock. That's a very exciting development. There's also air pollution from the fumes from the flowback fluid. How can we reduce this? Closed-loop drilling. Let's talk about well setbacks. How far should wells be set back? Here's a picture. Here's a picture of a hydraulically fractured well, very close to the residence. Here's another picture that I find truly terrifying. That is a pit full of assorted toxic substances right in the backyard. Remember, these pads are several acres in size. So it may be some distance to the wellbore, to the actual drill hole, but there's the edge of the pad right in the backyard. So let's look at the data about how far we should set back wells to reduce the public health. There's not much data about this, but what we know is the data that I presented here, that people who live over half a mile, let's just call that 2,500 feet from an oil and gas well, are at low risk from air pollution. Given still wind conditions, if you live downstream, you're out of luck. And we know that people who are 500 feet from the well are at high risk of air pollution, of health hazards. We know that water containing methane has been found up to a kilometer, about 2,500 feet from a well. Whether the methane itself is not toxic, whether this is a marker for potential groundwater contaminations is unclear. So what type of well setbacks can we recommend? Well, from a public health safety point of view, 2,500 feet would be really good. 500 feet, we know, is too close. In between that, I think we should attempt to achieve the greatest setback that is achievable. 1,200 feet might be something we can go for. It is reasonable, and most towns towns and incorporated towns that have ordinances like this have increased setbacks for what we can call protected use, including our public water supply, lakes, parks, schools, residences, and sensitive water areas. So let me talk up closed-loop drilling a little bit more. Once again, tremendous public health advantages could be realized from closed-loop drilling. It can reduce the use of fresh water by up to 80% because it recycles the water. It can reduce truck traffic by 75%. It can reduce groundwater contamination by eliminating pits and tremendously reducing spills. Reduces soil contamination for the same reason. Reduces air pollution from trucks, from pits, from flowback water. And it reduces the size of the drilling pad, because you remember that 3 to 4 acre drilling pad was largely pits, and eliminates those pits. Closed-loop drilling saves industry money. There was an article a few weeks ago in the Atlantic Journal about closed-loop drilling, and drillers said they were concerned because of the increased cost. Yes, the closed-loop drilling system is more costly to purchase. However, there have been several studies, comparison well studies, that show that closed-loop drilling reduces cost to industry. It reduces time to well completion, reduces water usage, reduces the number of truck trips, reduces disposal costs, and eliminates all the costs associated with pits. The total savings to companies has been up to $10,000 a well. This technology often saves money and is supported by all sorts of industry magazines as a good management practice for industry to save money while reducing liability. In addition, closed-loop drilling allows for pressure monitoring equipment inside the well pressure, which increases safety and allows industry to get more data. In our opinion, closed-loop drilling is a win-win technology. So briefly, in summary, our recommendations for reducing the public health risk associated with fracking in a doable way. First, closed-loop drilling. Second, disclose fracking fluid composition. This is currently the law. We recommend it be disclosed before drilling. We suggest monitoring water withdrawals, monitoring for water and air contamination before, during, and after drilling, achieve the EPA standards for reducing toxic air emissions, which are going to become law in a year and a half anyway. We recommend well setbacks of at least 1,200 feet. We recommend ensuring standards of well integrity by employing our own well inspectors in case the overworked inspectors from Texas Railroad Commission can't get to our wells in time, and additional well integrity safety features. We suggest multi-well pad drilling, which allows multiple wells to be drilled on the same pad, and if possible, to use reduced toxicity fracking fluid. Thank you.
Very good. Questions? Dr. Reed.
The only thing that you left out there was that these well inspectors, that we would have the oil companies pay a fee so that they could pay these.
We would certainly support that, yes. Remember, there are a number of problems with well inspections. Texas Railroad Commission is overworked. There are not enough inspectors. And there are issues about whether or not enforcement, whether infractions that are found are being adequately enforced. If well inspectors were employed to work for us, that that would probably ameliorate many of those difficulties.
Okay.
And
Dr.
I just
Stewart.
want to thank you and the committee for doing such a wonderful work. That's wonderful. Couple of things. Closed loop system seems like a common sense thing. I think the least we can do to prevent some of the issues we've been talking. That should be extended for licensing any company to be a fracking. That's the way it feels to me.
I agree. Closed loop drilling is recommended as a best management practice by several states, including New Mexico, and the Texas Railroad Commission has also recommended it as a best management practice. It is required by several towns, by several city ordinances, and is advised by legal companies who are advising drillers about reducing liability. It is really a win-win situation. A number of companies, such as Halliburton, are developing turnkey closed-loop systems. Several drilling companies, especially those in the Marcellus Shale, have switched entirely to closed-loop drilling. I'm surprised it hasn't caught on more, but especially with our concerns about recycling. Closed-loop drilling recycles fluids, and since there's so much concern now here in Texas about drilling and drought and the amount of water use, the case for closed-loop drilling just seems stronger and stronger.
The second question I have, and when it comes to the well setback, 2,000 feet or 2,500 feet seems a lot safer. That's not too much to ask for. Why compromise at 1,200 feet? Why can't we say we need minimum 2,000 feet?
There's not a good public health reason. There might be a political reason.
Okay, thank you.
Dr. Mack.
But I would love 2,500 feet.
You've put a lot of work in here. I do have a lot of concerns about what you said. EPA has not shown any public health hazards as far as I'm concerned. EPA has come out with nothing. The state of New York came out and had stated a couple of years ago about absolutely nothing. These, of course, were attacked because they're not politically correct. You mentioned air contamination. Methane. Greatest source of methane are wetlands, which are advocated. You go out to our playa lakes, you're going to find many, many times the concentration of methane in our playa lakes than you're going to find in any of these fracking pools. You have to basically wipe out all the forest land and all the wetlands on planet Earth for methane. It's a naturally occurring product, it's part of our biosphere. You also mentioned toxins in the fracking fluid, but you didn't address any of these. I find that to be a concern because just about any product, hydrochloric acid, sulfuric acid, salt, sugar, I mean, all of these are potential toxins. It depends on how they're used. If somebody just a pure sugar water, you're going to kill them.
Okay. Regarding methane, I'm not talking about methane. Methane is not listed as a toxic substance by the EPA.
The release of gases.
It's predominantly, yes, but it's hydrocarbons we're worried about. Hydrocarbons and benzene. I'm looking at...
also released from playa lakes and wetlands.
I think benzene.
All of these things are produced the same as natural gas that are produced in wetlands and in bogs and in peat bogs around the world.
We're looking
at floors of rainforests.
The toxins that I'm looking at are those toxins that are classified by the EPA as dangerous inhaled substances.
Carbon dioxide is declared as a dangerous.
No, I don't think it's on the EPA list of toxins.
Yes, it is.
We're looking here predominantly at hydrocarbons and benzene. Benzene is a very known carcinogen. So actually, it was on the slide here. This was written small. I wasn't thinking people would read it. The subchronic non-cancer hazard index of 5 for air pollution for people living less than half a mile away from wells was driven primarily by exposure to trimethylbenzenes, xylenes, and aliphatic hydrocarbons. These are the substances involved predominantly. These are hydrocarbons from gasoline
I got a question here. You say people living within a half mile. So the people who are working at the wellhead, and they're working at the wellhead all their life.
Yes.
Are there any studies that show that the people who work at the wellhead then?
We know they come to doctors. We know they come to seek medical attention for toxin exposure. And we know that, I believe in Pennsylvania, the doctors were complaining that they didn't have knowledge of what toxins were being used by companies, so that they didn't know how to treat patients. That's not an answer to your question, that's an example. So yes, we do know that people, the reason these researchers chose half a mile.
Are you saying half mile because of the chemicals they're using in the fracking?
This was a study.
No, wait.
This was a study.
No, is this what's coming out of the well, or is this due to the fracking fluid?
This, analyzing no, it's not from the fracking fluid is probably a relatively minor component of the toxic air emissions. The study involved sampling fluids from 350 and 500 feet from the wellbore and comparing it to half a mile away.
Fluids?
Air emissions. And they were looking at EPA-declared toxic air emissions. And they found, and the researchers calculated a hazard index based on estimated chronic and subchronic air exposures, and found these numbers. So the question, where is the fluid coming from? Where is the air contamination coming from? You have to look at what the contaminants were and see what they were from. But these are predominantly diesel and hydrocarbon-based elements that are associated with well completion activities. The predominant exposures occurred during well completion. So the levels were high during well completion activities and fell. So this is not from the highway, which was over a mile away. This is not chronic background because it peaked during well completion and then dropped off. These are well-related activities. From fracking fluid predominantly? Probably not. Probably we're dealing with diesel and air emissions, diesel trucks and the air emissions. Those are probably the predominant type sources of air pollution as judged by the composition of the pollutants.
But the EPA hasn't come out and said people who work at a wellhead should be wearing respirators or masks or anything else. That no alarm has ever been raised there. These people are working right at ground zero. So you're going down, you're increasing by a log, you're increasing by the square of the distance. So if you're 4 feet away.
Okay. The fact that the EPA hasn't ruled on it yet doesn't mean it's not happening. Studies are not complete. Data is low. We do have this piece of data.
And data is very questionable.
What bad? What we know is that there were other studies done by EPA of this same field. This is Garfield, I believe this is from Garfield, Colorado. There are other studies done from this field showing very high emissions of these levels. They were below the emergency action level. But what these researchers did is they calculated what the risk to health was with chronic or subchronic exposure, and they found it was elevated.
The other thing you mentioned was background radiation. Wherever we are on planet Earth, there's background radiation. I mean, you bring anything up from a well or a mine, you go out in your basement, take an old-fashioned Geiger counter, we've got background radiation.
It's not included in this study.
Dr. Reed?
You mentioned it, though.
Yes.
You mentioned it as a concern. You brought it up as a specific concern.
Yes, it is.
I think, to be fair now, what we're talking
Ted,
about.
I'm not being unfair about anything. I'm asking questions.
No, that's fine. Asking questions is fine. But to say, to try to, by inference, equate, say, toxic substance like sugar with what's coming out of these wells.
But she didn't
And
mention
first of all,
any kind of chemical, Ted.
Okay, but then she did. But what we're talking about is always dose. You know that. It's
Right.
always dose.
Absolutely.
Same with sugar.
Absolutely.
It's always
Absolutely.
dose. And dose has to be taken into account here. And that's the key element in all of this. You can talk about wetlands giving off methane, and you can talk about a wellhead giving off methane. And of course, what is being discussed here is a way of capturing most of these effluents to keep this dose down. And the dose is the problem. As you know, too much water will kill. But
Absolutely.
you have to be sort of reasonable about this. And what we're trying to do is be reasonable and try to set reasonable standards that will allow people to function and not have to worry about their kids. For instance, you talked about workers. You know that we have workers here, for instance, putting tar on roofs.
Absolutely.
Those guys are suffering, and no one does anything about it. And we let workers work in inhumane conditions in this country, unfortunately, still do. We should have standards to try to stop this, but we don't. I mean, they're inhaling incredible amounts of material. And we know these things are toxic, and there are toxic limits set on these kinds of chemicals. And we know that accumulation over a period of time will cause problems. Sometimes these standards take a long time to get into place, and there's groups of people that have commercial interests in blocking these standards. I know, for instance, there used to be, they would use carbon tetrachloride to clean things in cleaners. All the cleaners in the United States use this stuff. Turns out it accumulates in the liver, as you know, and it causes all kinds of damage. But it took years to get that into place. And as a chemist, I love chemistry. I like chemicals. You know that. But there's problems with this stuff. And we have to try to set reasonable limits. And closed-loop drilling, which is what really Dr. Epstein is really proposing here, is a way to keep down these emissions. Whether all these chemicals are going to cause problems, we don't know for sure. But some of these chemicals, as she said, can have serious problems. And I'm sure you will also agree that you wouldn't want to inhale a lot of benzene. This is not a good thing. So all we're trying to do...
Who's out sniffing benzene?
Well, I would hope no. Not. But what we're trying to do is just be reasonable here and to set what seem like reasonable limits.
Well, Ted, I'm not trying. I'm also trying to be reasonable. And the question is concern. It's contaminant concentration. If you test something for cancer, they give a high increased concentration to a rat or a mouse to see if it will produce cancer. That doesn't necessarily mean in low concentrations that's going to produce cancer in anybody. The same thing with the well here. If we're worried a half a mile out, are we worried about the workers at the
We probably should.
Yeah, we're worried about
well, you are, but I mean, the EPA has not come up with anything showing that there's any public health risks with fracking.
But as
and I think a lot of alarm is being raised for political purposes.
Okay. There is an ongoing study by the EPA. You can find it on their website. They've got round tables, and they've released a preliminary report in December 2012. It's preliminary. The final report will probably not be released until 2014. These are slow. They're related to roundtable discussions. Once again, the data is, we're slow to acquire this data. But other groups, the Office of General Accountability of the United States government has looked at issues of air pollution, and they considered air pollution to be a problem, a potential problem.
But just a report out from the World Health Organization saying the air is too clean on planet Earth. And we're not getting
Okay, for the sake of the fact this is not an action item, this is a discussion item, we will act on it next month, and so there will be opportunities for further comment in the actions. But Dr. Presley?
Just one comment on your recommendations, and I have other comments about the toxins you list there, again from crude oil, but to the summary of recommendations, you say setbacks at least 1,200 feet from human activity. What are you calling human activity?
Well, okay, I'm sorry for this. It's an erroneous abbreviation. What I'm referring to, these things are phrased in ordinances in a variety of ways. Sometimes they refer to any building or inhabited buildings, but there are usually ordinary setbacks from inhabited building, from sorts of buildings that people congregated in, and there are then protected sources, typically schools, parks, lakes, and there's a series of further protected sources such as delicate watershed areas and public water supplies. For example, I'm sure we want to be very careful about proximity to our wells in Bailey County, and very careful about our proximity to sources to Lake Allen Henry.
Okay. Answer your question?
No, but
So my brevity has overlapped the point of error here.
and when it becomes an action item, then we can
talk
refine
about
it
the
further,
detail.
because I think that is a very important phrase, human activity.
Yes,
It has to be clarified.
It should be removed here, and I should substitute.
Well, we
I'm not
can
sure what else.
fix
I
it
was trying to
later.
get it on one.
All right, very good. Thank you. Okay. This will come up again certainly as an action item at the next meeting. So as you have interest, if you want to research particular areas, that would certainly help as we discuss it next month. Thank you, Dr. Epstein. Okay. Scott, tell us about funding, what we're hearing from the state for STDs.
I had spoken with Becky and asked her to contact each one of the board to let you know that we have been contacted by the state in that the possibility of reduced funding in our STD program is possible. Now, to what extent, we don't know yet, and we will not know for some time. We thought it was important that the board know this. We also needed to contact our staff to tell them of these things before they went public. As soon as we find out to what extent that funding is going to be affected, and I believe our grant is for $194,000. And then our total cost of the program, Becky, $234?
$234.
So at that particular time, when we find those things out, we will let you know and report back. I would suggest that in the coming month we may know, so we'd like to put an action item on for the board at your pleasure to say that if you support the continued funding of the STD program at whatever level is not funded by the state, and you can work on the wording to be whatever you would like it to be, that you would make that recommendation to the City Council for the upcoming budget. If you do not wish to do that, then that also could be your recommendation to go back to the City Council for funding in the upcoming budget. It's up to the board what you recommend. We just wanted to make sure that you had the information, and we needed to, of course, give our staff notification because it does affect our employees. And I did not want that to get out erroneously, nor the amounts, because we're unsure of them, and the effect on the amount, on what it does to staff or supplies or anything, how it affects our program. We can make adjustments. At some point, we'll know more about that, and we will let you know.
Are you saying that, for example, even before we know exactly what the funding change might be, that it might be good for us to, as a committee or as a board, to say we believe that if there's any change in funding that we would hope the City Council would support, so we could bring it up at our May meeting?
Absolutely.
Okay,
And,
all right.
and,
Okay, so put that on our May meeting.
I think that has to be more or less, that gives you the flexibility to do it whichever way you want to do it.
Okay.
You can be very specific, you can be very general, but we will know what our budget costs are, and we do know those from previous years. And so the amount that is not funded, you could ask for that gap funding to come from the City Council and their consideration of the budget.
Okay, all right, very good. All right. And Mary, give us an update on communicable diseases.
All the enterics were at or below expected numbers for the month of March. We had 10 invasive strep cases, 1 invasive Neisseria meningitidis, and 1 Yersinia intercollectica, which is very unusual for us to have.
And hard to say.
And very hard to say. I almost didn't study.
Okay. Any questions?
Mary, I'm glad to know that we didn't have any TB cases in the last 3 months.
We have a problem getting those numbers.
Oh, I see.
We do not investigate tuberculosis. That's done by the Department of State Health Services, and those numbers are not always available to us.
We don't automatically get them from the,
We should,
we used to, I thought.
and I'm not sure what the problem is. The information is asked for, but we don't always receive it.
It is requested and they're not returning it?
Yes.
Okay. I just wanted to voice that.
Okay. Another question, Dr. Mack?
On these infections, the streptococcus, the pneumonia, and that, do we have any indication of how many of these cases are fatal? Do we get that type of information? That would be useful to us to know whether these are transient infections or whether the patients succumb to sepsis in these cases.
Right, I would have to look it up, but it does not, I would say out of the 10 cases in March, that none of them were fatal. This is just my remembering out of my mind, but
Now, are these coming out of hospitals or medical centers, or where would you?
hospitals, they do blood cultures, and if they grow any of the species, these particular group A, group B, and strep
It'd be
pneumo.
useful if we could
it's
find out
reported.
if, because people do die of sepsis, and that's not a rare occurrence anymore, but if we could find out,
And we do know of the cases, these 10 cases we investigated, if any of them were fatal or not.
that'd be nice if we could
follow up
have that as
to
part of
where
the
they're.
report.
Oh, okay.
That would be very useful, I think, to give us an idea
I
of
can do that.
how successful the community is handling this, or whether we've got specific problems. And the certain individual medical facilities, Dr. Chikuru would do better at it.
And I could only report on those cases that were reported
Report
to
to you,
us.
yeah, and
You
you
know,
may not
I'm
be
sure there's
involved.
many out there that aren't.
Yeah.
Dr. Frizzle?
There seems to be a rise, and it's anecdotal that I hear, but y'all may know, some of you, adenovirus. Heard
That's
of-
not reportable.
Yeah, I know, but it
We
seems
don't
that there's a lot going on right now.
Where are we seeing that, Steve? What,
I've got 2 grandsons with it, you know, and I've heard people at work saying that it's going around.
is this in the pediatric population?
No.
Or
No.
across the spectrum?
Teenagers.
Teenagers.
Yeah. It's real common in crowded conditions, and I'm just, this weather, it's predisposing people, I guess. I
We
just wonder if
haven't
y'all
had
ever
the schools call us with any of that, anything like that, Dr. Chrisley, they usually do. You haven't gotten any calls from schools about it?
Okay. All right. Anything else? All right. Just very quickly, the item 3.4, call for further future study areas to the Board of Health. This is just related, I think, to some of the, like the STD funding, where now that we've got kind of the team is all back on board. And one thing I would just kind of throw out there is, so we have the 3 areas that the health department takes care of: surveillance, immunization, and STDs. That as we've got, I can see the hydraulic fracturing is kind of coming to a point where that's going to be largely done. I'd thought that it might be useful if members of the board had an interest in going down and actually going to the health department and taking one of these areas, or whatever you want to do, and let us become well informed. So, for example, in the STD clinic, if funding is reduced, that we have representation on the board who can go in there and talk about the nuts and bolts of what that clinic is doing, and that's kind of a bad choice, and come back and say, is this essential funding? Is there other funding available? Where do we need it? We also have the health educator going to come on board. That's included on the last budget request at the city council, and so I think it would be good for us to be able to go down and say, all right, so if we get this health educator, what exactly might they do, and where do we see the priorities needed within those services? Just like I was wondering, like under immunizations, at one point we were talking about getting funding for that van, and it just kind of went poof. I don't know.
We have our van.
You got the van?
The van is funded and
We
being
have our van.
used.
Oh, can we take that this weekend? Drive it?
No, if you want to get some immunization.
Okay, well, but see, so I didn't know that, and see, so some of this would be, and so all I'd ask is, again, for the sake of time, I think next May is a good time for us to say, what are some other things that we might want to look at, some other goals? And so I think between Kay, with your background in health educator, maybe you'd want to give us some sense of what does that person do, assuming that we get the funding. Certainly if we get support in the use of social media with the city council and the mayor, we're going to have to come up with an idea about how to do that. And so before we do those things, I think we need to know what it is that's happening down there every day. And, when you and I talked the other day, you said that it's a small enough group that really, with just a little lead time, it would not be difficult for any of us to come down and kind of tour the place and and really get a sense of what's happening so that we can be better advocates for what you guys are doing and not always just more on the scientific arm of advising council.
You're always welcome.
Okay.
One thing that I'd like to point out, Ron, is I don't think that any of us know, and the health professionals are well more versed on this than I, on what the effect of the recent changes in the healthcare law is going to take upon our services.
Mm-hmm.
We do know that it's one of our goals and objectives in these grants that we try to get people to a medical home. And we've seen reductions in our numbers this year in the immunizations because we believe that program is working to get people to a place where they're treated on a regular basis, and that the change in the law could further reduce the numbers of people that we treat. We don't know what the effects of those will be on any of these programs. So everybody, I think, needs to keep that in mind, and we won't know that until everything goes into effect. But I will tell you that I think the state is anticipating that the treatment numbers, ours is the only clinic in the state that is funded for STDs. They fund no other clinic in the entire state for STD treatment. So, be that as it may, we may say for a 10% reduction or a 100% reduction. We just don't know that yet. So, you might keep those things in mind. Who knows what budget crunches are going to come to pass after healthcare changes.
Right. Okay. All right.
And could I ask
Yes.
to add a vector control or surveillance and control report next month with Glenn?
Perfect.
Absolutely.
Because it is getting
Coming into the summer.
The other thing,
there's some dire predictions for this year.
the other thing I was going to ask is, do you want an action item on for a recommendation from the board on the fracking issue?
Yes.
I have it.
Okay.
And see, and I know we've talked about we need to flush this thing out more as a resolution, so we'll have that next time that we can take line by line and then forward to council. All right. Anything else? All right. So we need to approve the meeting minutes from March. Do I hear an approval?
Second.
Move, and Dr. Culp, second. Okay. And any other business announcements, activities? No?
Oh, you were going to ask about the contact sheet.
Oh, yeah, I asked Becky to give us an updated contact sheet. And so if you'll look on that, and if any of the information is incorrect, if you would please get back with her, just so that we have a way of, as we need to contact you, we've got all the latest information. So if you would just look at that and then report it back to her.
I might also say, please be careful in those communications that you abide by all the open meetings rules and laws, and you know what those are.
Right, okay. All right. See you in other business then. We will adjourn the meeting and see you guys next month. Thank you. Okay, so I've signed that.
Well, thank you, sir, very much. Hey, Dr. Presley.
Yes, ma'am.